It's good to see so many friends of the Arnold School here today. I'm Tom Chandler. I'm the dean. I know most of the people in the audience here, but I couldn't be more proud, particularly to start this lecture series. It's one of the first things we've been able to do with the recent gift from the Arnold family that established the Gerry Sue and Norman J. Arnold Institute on Aging. And that gift came really with the charge to look at the two ends of the human age spectrum, to look at senior citizens, particularly mental health and physical well-being, and at the other end, looking at children and adolescents' health. And Norman in particular had a special interest or concern about the childhood obesity epidemic and the role of good nutrition education, nutrition practice, and especially physical activity. Norman, as you know, passed away in August. I'm sure he would have loved to be here and meet you, Jim, and hear what you're going to talk about today. But anyway, so Michael's going to say a few words about Jim, but thank you for coming. And we have refreshments at the end, and I hope we can all get to know each other better. So thank you. Michael.
So I want to say thank you for the great turnout here today. This is really impressive. I was hoping it was going to be standing room only, but it appears that only the photographer is standing, but that's good. That's a good sign. So before I introduce today's speaker, I want to at least take a quick moment and recognize two outstanding graduate students that are doing great work in childhood obesity areas. So as part of the Arnold Childhood Obesity Initiative, we developed a professional development scholarship award for graduate students in the Arnold School that are on a trajectory to doing great work in childhood obesity. And so for this year's award winners, we have two outstanding young ladies, named Morgan Clinton and Morgan Huey. I'd like you to stand up, and I have a little something for you. And so these two young ladies were outstanding applications in terms of the amount of scholarship that they've already doing and their trajectory in terms of their contributions to the childhood obesity area. So we're looking for great things, and maybe you'll be invited back as the keynote speaker for this in a few years. So I want to say before I turn it over to Dr. Sallis, I want to just say that I'm extremely excited, proud and honored to be introducing our speaker here today. I'm sure like many of you, I know that I have fond memories of my graduate studies at Wichita State and Oregon State University, where I grew up on a healthy diet of Jim Sallis publications. And I think at that time you were only doing about 25 a year, so it was pretty good. But I know that many of you in this room know Jim Sallis's work in some form or another, but I thought I'd take this moment just to share some highlights of his career that he has accomplished. So, according to the Web of Science, we all love Web of Science, he has 594 scientific peer-reviewed publications, and that's since 1975. So if you've done anything before that, this is a little under-reporting. Those have subsequently been cited 45,000 times, actually 45,513 to be exact. His H-index is 102, which means, for those of you unfamiliar with H-index, he has 102 publications with at least 102 citations each. His most highly cited first author publication, do you want to give that a shot? You know what it is? A review of correlates of physical activity of children and adolescents, so that's very appropriate for today. It's been cited 1,780 times since yesterday. He played a huge role in the creation and the success of active living research, which was created back in 2001, which over the lifetime of when they were awarding grants had awarded 238 grants on a physical activity related topic. Not surprisingly, Thomas Reuters, back in 2015, recognized him as one of the most influential scientific minds of our time. So very impressive, very impressive. So while I think that those are nice metrics, I'd like to share a few things that maybe you're not going to see on a Google Scholar search for Jim Sallis. So I first really met Jim Sallis back in 2013 when I attended an active living research conference in San Diego. And for those of you who have not been to an active living research conference, they always have a physical activity afternoon. And you can sign up for various physical activities. And I elected to do bike around the beach or the bay that Jim Sallis was leading. And I have fond memories of biking around this beautiful beach vista area and talking about the various succulents that are growing in the gardens and the planters there. And I think that from that time, I quickly realized that Jim Sallis is one of the most user-friendly individuals of his stature. And some of the choice words that come to mind when I think of Jim is that he's genuine, he's energetic, he's creative, he's accessible, and I think many of you would agree that know him, he's just really a nice guy. I think that his leadership and his dedication to the field was demonstrated through his work and dedication to the active living research, where with those 238 grants that they awarded over that lifetime, I would consider those to have probably likely jump-started many new careers in physical activity research from those awards. So in total, I think that Jim Sallis represents a lot of the qualities that we should all strive to emulate throughout any stage of our career. So with that, I'd like everybody to give a warm welcome to the inaugural Gerry Sue and Norman J. Arnold Child Obesity Lecturer, Dr. Jim Sallis.
We just had a discussion with you, Michael asked me to talk about the future of youth physical activity research. So that's what I'm going to do. I'm going to give you my version of things, but I think we can make this a discussion as well. So I invite you as we go along to raise your hand if you have a question, a comment, a challenge, a disagreement, any of those things. And we have a microphone that will come to you. Right there. So raise your hand and Keith and the microphone will come to you. Let's get started. And I'm going to kind of get right into the heart of the things. Not a lot of introductory material, but I want to dwell on the obvious just for a couple of minutes about why physical activity. I've been studying physical activity for 35 years, and you might ask why? How can you spend so much time on one little topic? Or as my mother liked to say, oh, haven't you figured this out yet? It's been so long. But anyway, I want to tell you why it's worthy of my attention, your attention, hopefully. And then I'm going to organize my talk by the behavioral epidemiology framework, and I'll tell you what that is. And then I'm going to propose some research priorities for each of the phases of that framework. Okay, so this is from the Lancet series in 2012, and based on self-report, 80% of adolescents worldwide do not meet physical activity guidelines. So that's pretty horrendous. And this is self-report. And we're pretty sure that most people over-report their amount of activity because of social desirability. So that's really concerning. So let's zero in on the good old US of A. And here's data from accelerometers, objective data, from 10 countries that were processed and scored to be comparable, so that we can look at them together. And I circled the country that's at the bottom of the barrel, the least active country, and you will see that just by coincidence happens to be us. Which, in the context of 80% of the world's kids not being active enough, we're close to the bottom. So that should be concerning to everybody, not just physical activity researchers, but if you're a parent, if you're thinking about becoming a parent, if you're concerned about our future workforce, if you're concerned about healthcare costs, if you're worried about how many people are going to become diabetic, any of those things, you should be concerned. And just to put it in perspective, you know, the guidelines for youth are 60 minutes a day of MVPA. In this sample, it's about 45 minutes. The highest is Norway at 84 minutes, almost double, close to double what we are. So, of course, that's possible if you arrange your country and your policies and your, you know, you put an emphasis on getting kids active, which apparently they're doing somewhat. So anyway, that is one part of the situation. So that's kind of the bad news, but the good news is if we get kids active, many good things happen. And again, I don't want to go through a litany, but I want to show, I know there's people here from the education department, and this is something we've been struggling with for so long. The more we learn about the health benefits, the brain benefits of activity, the less activity kids do in school. So something is not working right in this system. There's something wrong with this picture. But I just love to show this because it illustrates, and I'm pointing over here because I'm looking here, but I know you're looking here. So please forgive me on that one. But on the left is the brain scan of a kid who's taking a test after sitting quietly for 20 minutes. And you can see not much of the brain is activated, and what is activated is turned on weakly. And on the right side, after just walking, and this is not playing squash, this is not 90% max on the treadmill, just walking. Look at how much more of the brain is engaged and how much more intense the brain activity is. And I don't know, I think if I was a teacher, I would want the right-hand brain in my classroom. And so there's an easy way to get the turned-on brain. Have the kids move. But apparently the logic of that is not apparent to teachers and principals and education administrators who are working hard to get kids to sit down as much as humanly possible, regardless of how unpleasant and how twitchy they get. But anyway, that's a very important finding for our society and our education system. And it reminds me to say, you know, sitting is not that good. So there's plenty of space if you want to get up and walk around. You notice I'm not just standing behind the podium. I'm taking my opportunity to walk around. So I didn't check my steps before, but I'm sure I'm going to be adding some steps. I forgot to quantify it though. So anyway, you're welcome to stand. And just one other thing. This is a study out of Texas and FitnessGram data. And I know this is part of the Childhood Obesity Initiative lecture series, but I want to show that fitness, which is stimulated by activity, may be even more important than obesity in some cases. And so here what we have is the correlation of the red bars are fitness, the gray bars are BMI, with higher scores of academic achievement. So both BMI and fitness are positively correlated with academic achievement, or being in the healthy BMI zone or the healthy fitness zone is better for kids' academic achievement. But as you can see, fitness is more strongly correlated. And the second one there is attendance. So again, better fit kids, more correlation with attendance than healthy weight zone, and the fit kids have fewer disciplinary problems, right? So having lean kids is good, but having fit kids is probably better. Okay, so that's the background. Stuff you basically know, but maybe some details that you weren't completely familiar with. So now I want to go, okay, so let me see. Any questions, comments? We want Keith to get some steps here too. Yeah. So please be bold. Don't be shy. Okay, let's move on. Behavioral epidemiology framework. This is something that we published now 15 years ago. My colleague Neville Owen from Australia and his doctoral student at the time. And because we wanted to bring kind of a sense of the big picture of research, not just for physical activity, but for basic health behavior in general, from a population point of view. And so our thought is to improve public health, we want a spectrum of analytic, descriptive, and intervention studies. And if all we do is study the health benefits of physical activity, that doesn't tell us how to intervene better. That might motivate people to want to be active, but it doesn't tell us anything about how to get them active. So we proposed 5 phases of research, with the idea that, at least over time, all of these phases should be represented. So here they are. Behavioral epidemiology we see as different from classic epidemiology in that it's explicitly interested in intervention. So there's an explicit goal of intervening and improving. So phase 1 is establish the links between, let's say, physical activity and health outcomes. And that's classic epidemiology. So that's the same thing. So we need our partners in epidemiology to help us understand this, because it's important that we know the dose response and can come up with the guidelines, etc. So the second, if the behavior is really important, then we probably should measure it well. And part of the history of physical activity in epidemiology was that people didn't pay much attention to measurement, because no matter how badly it was measured, there were amazing relationships and predictions of health. All right, so they said, well, 1 or 2 questions is really all we need, because that gives us a good odds ratio, and we don't need to do any better or lengthen our surveys. But if you're wanting to look at really quantify what's the effect of your intervention, you need to measure it more precisely than how often are you active, none, some, or a lot. We need to do better than that. So, and then as we get good measures, we want to apply those in surveillance. Tested, evaluated measures in surveillance. Then, the third phase is to identify correlates, determinants of the behavior. And apparently people are interested in it because that's our most cited paper. So certainly there is interest in it. And it's a way to generate hypotheses about the mechanisms of the behavior change. Because if we find that social support is correlated with activity, that people that know others who are active or get encouragement to be active, if that's correlated with activity, then you might say, well, if the hypothesis would be if we intervene and improve social support, then that should be a mechanism for increasing physical activity. So, so in fact, the correlates studies can be a part of the evidence to inform the design of interventions. Instead of guessing, well, I think that if we intervene on having people smile more, then they'll be physically active. That's a hypothesis, but on what basis is that hypothesis? So the correlate studies give you an empirical basis for developing your intervention. So then the next phase is to use the evidence and develop interventions to increase activity and then evaluate those. So if a field is not doing intervention research with rigorous evaluations, well, you're not really learning what works. And there's no guesswork is going to substitute for good evidence. And in most places, most investigators would say, okay, once we determine what interventions work, our job is done. We've been successful. We've identified effective interventions. And there's something to be said for that. But in my view, that is not the ending point. The point of behavioral epidemiology is to improve public health and to create evidence-based solutions that are then implemented, that are used by somebody. So I just taught my first class of the quarter on Monday on health behavior interventions, and my goal was to indoctrinate the students, the doctoral students, that if you develop a behavior change intervention and find that it is effective, your job is not done. Because if all you do is publish it and nobody ever uses it, what is your impact on public health? It is zero. And you could have a very successful career. You could have a lot of publications. You could have a lot of citations. You could be promoted. You could be invited to give lectures because you have a whole portfolio of effective interventions. But you could have zero impact on public health. And who would be satisfied with that goal? If you're in public health, probably you got into it to make a difference, to make an impact. So, so we added on our last phase, which is not the second phase 4, it's phase 5. So the idea is to translate that research into practice and to apply and disseminate effective interventions. So how many of us were trained in graduate school how to do that? One. Not me. I'm just demonstrating how to raise your hand. Okay. We have a couple who were trained in dissemination, implementation, and research translation. Not the rest of us. Well, how are we going to learn that? Well, that is my challenge to you. That's what I'm hoping to do with my class this quarter. So anyway, that's the framework. And I want to now go through the framework and give you my suggestions for research priorities in each of these. But I'm going to throw you a curveball. I'm going to start with the last phase because I think it's the most important. Because I think we've made a lot of progress in understanding the health effects of physical activity. We've certainly developed a lot of measures. I think there's more to do. We've done hundreds and hundreds of correlate studies. We have lots of interventions that work, but we have very few that are actually being used. This is the big, to me, this is the critical need in our field, is to take the interventions that have been shown to be effective and figure out how to get them used in the real world. And there's a lot of interventions. So and one of them is physical education. There's a lot of meta-analyses. There are guidelines from the Community Guide, from the Heart Association, from Department of Health and Human Services, say that active or enhanced physical education has plenty of evidence behind it. But in the real world, especially in elementary school, usually people aren't doing any physical education at all, or certainly not meeting the guidelines for the number of minutes, much less the quality. So we're really, doing very poorly in implementing what we know about active physical education. So the question is, how can we be more effective in attracting commitment and support for whole-of-school approaches to physical education and physical activity from education decision makers? To me, that is the big research question in school physical activity. How can, because we know the most about school physical activity programs, but we're probably doing the poorest. So here's an example. This is the mid-course report from the physical activity guidelines, which was really not about guidelines, it was about interventions for youth and doing a lit review. And you see, there's a couple that are have sufficient evidence, multi-component school programs and good, active physical education. So, and you can see there are others with suggestive evidence, active transportation, activity breaks in the classroom, programs in preschool and child care settings, and built environment. So that's where evidence is really building, may not meet criteria for being of sufficient evidence, but we have some evidence there. And then others have just not been studied enough, or the evidence is just not very strong. But we have several here with suggestive or sufficient evidence. So it's time to think about more seriously, how can we disseminate and implement? So I like to show these pictures because they show what PE is too often. And I've been showing these for years because I just went out one day and I took a couple of pictures, and I find this just a classic because this class is not physical. It's only one kid doing any movement. It's not educational because look at these kids, they're not paying attention at all. And all kinds of bad practices. So in Michael Beek's office, you want to not have lines. There's a line. That you need equipment. One ball. I like to say, how well would our kids learn to read if the whole class was sharing one book? Same thing. And the consequences can be really sad. Because I don't know if you can see it, but what happened just after this picture was taken, that ball bonked her on the head. Because she only gets one practice shot per class. You can't learn to shoot a basketball with one practice shot every week. So anyway, then I was able to go to Japan and see some really good physical education. So look at the teacher. Oh my God, she's dressed appropriately. She's demonstrating something. She didn't bring her purse with her to class. And the kids are happy, they're active, there's balls, there's no lines. Okay, so PE can be fantastic. Should be fun. We want to make it fun. All right, and there's lots of evidence-based programs. There's evidence-based programs for elementary school, middle schools, high schools, including LEAP program for high schools, done here, developed here, evaluated here. So we know how to do it in all ages, not doing it. Here's a little bit of evidence about this. This is just a small study from California. They went and observed some PE classes in elementary, middle school, and high school, and the kids are only active 20% of the time, up to almost 1/3 of the time. Well, the guidelines from CDC are really 50%, and 50% doesn't sound like that much. But and I think it's most studies show that kids are active about 1/3 of the time in elementary school, not very active. So what's dissemination and implementation, D&I? It's a relatively new science that wants to understand how to facilitate deployment and use of evidence-based approaches to improve the quality and effectiveness of health interventions. All right, so easy enough. Here's a model, this is they're calling it a translation pipeline, translating research to practice. So an efficacy study, or your typical randomized study, will show could an intervention work when the investigator is in charge of training, and it's you have more control. And so that's a starting place. And then you want to see, does a program work when we roll it out to the community with people who probably don't have a degree in exercise science, never had any training except what you give them. They're working in the real world. They have very small budgets. They're underpaid, so they're probably a little grumpy about what they're doing some of the time. And then, if you can make it work under those circumstances, you know, it's really what else can you do to make the program work better? And so here are the steps. And exploration. And everybody that does any kind of dissemination will tell you that every setting is a little different. And so you need to understand the local situation and see how you can adapt the program and or adapt the intervention in some way for the setting or for the audience, the target population. And then you want to make adjustments as needed, work on adoption, and then implementation, and hopefully sustaining the program over time. And so it's the exploration and adaptation that we need to be working on, adoption, implementation, and sustainability. These are different kinds of questions, and methods are being developed. So for D&I research, they often talk about hybrid designs, so that you can have some combination of effectiveness studies and implementation studies, with one of the ideas being that you need to design for implementation from the beginning. So, you know, hybrid design one is mainly an efficacy study where you test the effects of the intervention on outcomes, but you also gather some data that will help you plan for implementation. If that's where you don't have enough evidence about the effectiveness of the program, but you're looking for, you know, you're looking ahead. The second design is dual testing of health and implementation strategies. That would be where you have a control group, and then you have an implementation group with just training and no follow-up support, and then a third group with training plus follow-up support. So you're testing both the efficacy of the intervention and you're testing an implementation strategy. And the third is you're just testing an implementation strategy, and you might gather a little bit more information on the outcomes, but the emphasis is on the implementation strategy. So let's see. So there's actually an office at the NIH through the National Cancer Institute on the Office of Implementation Science, and they put on trainings. They have a lot of materials, they have a website, and I would encourage you to get familiar with that, and I'd encourage some of the faculty to incorporate some of that into your classes. Okay, so now, my suggestions for needs about youth physical activity research, how are effective interventions diffused, adopted, and institutionalized? So that's kind of a big catch-all kind of question. It would be also nice to quantify the public health impact. If you're studying park renovations then it'd be very useful to quantify that impact, not just over a week of when you're doing your main outcome evaluation, but maybe to extrapolate that over 5 years or 10 years. And how many calories would you estimate would be burned, and what potential impact could that have on weight or pounds lost or pound gain prevented in your community. One of our big weaknesses in the physical activity field is our lack of information on economic factors. Because when school officials are asked, well, why don't you improve your physical education? Usually one of the first things out of their mouth is, well, we can't afford physical education teachers. It's an economic argument. And we don't have economic data to refute that or support that or provide a different perspective. And we don't have data on what are potential costs or other savings outside more physical activity. So decisions about program implementation and sustainability are very often made on an economic basis. So we need to create data to address that. And that's a different set of skills than most of us have learned as well. So, but there are economists and others who have those skills that we can bring into our research teams. So what drives decision-making about adoption and implementation of evidence-based interventions in schools, parks, healthcare, senior centers, and elsewhere? We need to know that. We've learned a bit about that in schools, but I don't think about so much in other settings. And we might want to partner with communication researchers to learn how we can communicate the lessons of research better to decision makers. What types of information do they pay attention to? What's compelling to them? Where do they get their information? Who do they want to hear it from? These are very common communication questions, but I don't see them being addressed in the physical activity area. And just as one little example, not of a study, but of a different way of communicating, when I ask decision makers, what kind of information do you want, would be helpful to you? They always say, well, we need to know about the money. What's it going to cost? What's it going to say? And how do you want that information? Well, I'm not sure, but I know I don't want it in journal articles because I will never read one of those. So right away, the way that we communicate is not getting to the people who could use that information. So in our work, and I'm sure several of you, and I'm sure the PRC is putting out research briefs and policy briefs where you give evidence-based information in plain language for the layperson. And that's great. And we've had a lot of success with that in active living research, and some people like that. But some people say, well, that's 3 pages. How am I supposed to find the time to read all of that? So we said, well, gee, I don't know. And then people told us, well, why don't you use infographics? So now, this is a very hard transition for a researcher. It's hard enough to kind of dumb it down to regular person language and not use our jargon and p-values and r-squares, but to tell about our research in a cartoon. I mean, that just seems ridiculous. But people love it. And so here's results. Here's numbers in a way that people like looking at because they're drawn in by the pictures, and then they, maybe by accident, see a few numbers and remember that and then quote them to their friends and colleagues, and then they're the expert. They've got factoids and quotes that they can spout, and all it took them was 5 seconds to read that number about recess can provide 20 minutes a day of activity. Okay, so we think these are really, really fantastic, and we've had just super feedback on them. And of course, people are using these infographics for all kinds of things. Okay, I'm going to move on to phase 4. Who's got questions or comments? Who thinks none of this is the job of researchers? I've had many people tell me, or several people tell me, it's not my responsibility to make sure that my research gets used. I don't have those skills. I'm an efficacy researcher. So what I teach my students is if you have an intervention that works and you don't take responsibility for disseminating it, no one else will. Yes?
It just seems to me that the biggest problem we have is that we're living in a bubble that's been created by these translational frameworks that have us move from bench to bedside to disseminating stuff that we've built sequentially, and that in the end, I don't know, I guess maybe I'm asking for examples that you know of where that is actually working, because it seems to me it's not working, and you would have just done a fantastic job of telling us how to push against the walls of that bubble so we have even a chance, but we're still in that bubble. The alternative is get out. Let me give an example. So in the kind of work that I do on infant young child feeding, the Gates Foundation said, okay, we know that improving infant child feeding in poor countries is important. We haven't got a clue how to do that, really. So we're going to give really smart people a lot of money and forget about these translational models. Go into countries and figure out how to do them on a large scale, like a fourth of a country at a time, and just invest $77 million and figure out how to do it so that we all learn from that. Rather than investing the $77 million in all of the steps of the research and then trying to figure out how to disseminate it. Maybe that's an alternative. I was wondering.
It would be an alternative if anybody would put $77 million into our work. I have not run across that myself. So yeah, maybe that would work. I think there are several ways of doing it. And again, I don't think we understand these very well, but there's several ways of doing it. One is, I'll just give you my example. I've always been interested in making an impact. That's always been my goal. I want to develop an intervention and then have it used. And I've tried to do that several times, and I've had several interventions that were not effective, so you stop there. But I've had some where we have gotten some traction, and some where really it hasn't been used at all. And I can't give you a good explanation why some of them work and some of them don't. But I'll just tell you of my own personal experience with our SPARK program, elementary physical education. Initially, and then we studied it in middle school. I said, well, we've got something. We evaluated it. We showed it. We got kids active and more fit and better skilled. So we know we're doing better than the controls, what the kids are usually getting. And we said, we don't think we can get a dissemination grant because this was 20 years ago, and there was not an office. There was not a field. So we said, well, we're just going to try to go into business and see if people will buy our curriculum and our training. So we sent our lead trainer out to talk to schools and see if they would pay for physical education that was better. And you would think, well, what would be a worse business to get into than trying to make money off of physical education? That is at the bottom of the priority list in schools. But what we found is that there was what business people call a pain point. They knew that they weren't doing, a lot of schools knew that they weren't doing a good job in physical education. They wanted to do a better job for their kids. And they knew they hadn't spent any money on physical education in decades. So, so they gave it a try. And so, against all odds, that 20 years later, it's still a business. And it's being disseminated, not through research. We didn't think we could do that. But it is an evidence-based intervention that is being implemented. And I think part of it is because we were building on an existing infrastructure, an existing system. We didn't have to invent physical education. We just had to take what was there and make it a bit better. And I'll give you my biggest failure in this area. We did an intervention, very small study funded by CDC, developing materials to help physicians counsel their patients for physical activity. And we showed that a little bit of counseling increased physical activity, at least over the short term. And we said, great, here's something that physicians want to do, that patients want, that is effective and feasible. We didn't think we could sell it, so we tried to give it away. We tried to give it away to the Heart Association. They said, no, we're not interested. Tried to give it away to ACSM, see if they would disseminate it. No, we're not interested. And then we said, I guess it's up to us. We have to do it. And we tried to sell it and do trainings, and we were not very successful. And I think one of the differences there was there is no system for health behavior counseling in primary care. This was 15 years before exercise is medicine. So the system was set up to punish people who spent time providing counseling. And so it didn't work. So we kind of knew that the system was not very accepting of it, but we didn't have any control over changing that system. So it hasn't changed much since then, I don't think. So there are different ways of doing it. Now there are great opportunities. How many health apps are there now? How many hundreds of health apps are there now? And every study that I know that's looked at them says, well, there's no evidence-based anything in here. And so that seems like an opportunity to combine the research, what we've learned from research, with this amazing dissemination platform. But there's barriers there too, because apparently the app makers think they don't need us. So developing partnerships may be a little difficult. But there are many different models, and taking responsibility for disseminating doesn't mean you have to do it yourself. It might mean finding the partners, or working with your university to incubate a company, or to find a company to partner with. So I think there's many ways of doing it. But if the investigator doesn't take some kind of initiative, I think nothing will happen. And I think it's worth the risk to try to make something happen. Either from a research point of view, let's learn incrementally how to do this, or let's see if we can do this ourselves through some other methods. So anyway, I'm not saying this is easy, but I am saying it's a problem that we have to pay attention to. So I'm going to go to phase 4 and finish pretty soon. Evaluating interventions to promote health behavior. That's phase 4. I'm gonna just cut to the chase. I think we need to evaluate youth physical activity interventions that are being recommended, but without much evidence. And one of the things that comes to mind is joint use agreements, shared use agreements. They're being promoted a lot. They make a lot of sense. They should help reduce disparities by making physical activity more available in disadvantaged communities, but there's no good studies of them that I'm aware of. So I just think that's something, and they're being done all over the country. So there are things going on, and they could be natural experiments, or they could be controlled. I just think that's one example that we could do. And so we want to, another one might be the new ESSA, the Federal Education Bill, makes physical activity and physical education in schools eligible for federal funding. It expands the pool of money available. So it would be interesting to see, well, what's going to be the impact of that? And what kind of schools are applying for this money? And if they get the money, what do they do with it? And how effective is that? So I think this is a new policy. It's a major one for the field and ripe for study. That policy is an intervention. Not randomized, but there are lots of questions that could be developed around it. One idea here to improve the transition from research to dissemination is to get practitioners and decision makers on research teams. Get them involved in coming up with the questions, especially about implementation. And then, if you've got a school superintendent that's actually on your research team on the grant, then and your project is successful, then you've got a built-in conduit to communicating with other school superintendents. And probably they can do it a lot better than you can. So that's a way to kind of integrate an implementation perspective into your research just by who you have on the team. Okay, I think I'm going to skip this. Okay, I talk about shared use agreements, so that's fine. Okay. I'm gonna take back what I have up here because it said build evidence for rarely evaluated interventions, including preschool interventions. I don't think that's under evaluated anymore. I think there's a lot of evaluations of that. Youth sports and dance classes, I think, still are under evaluated. Millions of kids involved in these activities. And I think parents are relying on them to provide activity for their kids out of school, but very, very few evaluations. Improve approaches with inconsistent evidence. Okay, you've got people like Michael here who are doing some of this. The after-school programs are a great opportunity. Some pretty depressing literature that I've seen. So there's probably improvements that can be made. And make evidence-based interventions better with focus on better implementation through training and program design and support. So classroom activity breaks, recess interventions. We made a lot of progress on those. We can still probably make them better. So instant recess, which we're going to do in about 5 minutes. So get ready to move a little bit. Okay, so of course I'm very interested in policy and environmental interventions that reach a lot of people and last for a long time, because most programs don't do that. How do we optimize park designs for youth physical activity? Those would be difficult studies to do, but really important. To have evidence-based guidelines for park designs for promoting physical activity, I think would be a game changer. How to design safe street crossings and sidewalks and bike facilities for youth so that their parents would be comfortable letting the kids ride their bikes around. How many of you rode your bikes around the neighborhood? Most kids don't do that now. So how can we create bike facilities that will change the perceptions of parents about letting their kids do that? So just some examples there. Let me talk about these. Wait a minute. This one. So apply ecological models. Yes, you.
So what did they do in Norway?
What did they do in Norway? I don't know. I think we need to study that. We need to make these international comparisons. But I'll tell you one of my favorite stories about Norway's neighbor in Finland. Russ just heard this the other day again, but I saw this op-ed in LA Times newspaper a few months ago, a year ago, about this American guy who took his family and worked in Finland for several months. And he said, and he made the point, Finland almost always comes out on top of international rankings in education. They always do better in math and science and reading and all this stuff. Their education system works, okay, somehow. And he said he was just shocked at what kids did in school, because they would go out to play every day, no matter how cold it was. They would spend 15 minutes being active every hour of the school day. They valued physical activity. They thought it was one of the most important things for kids to be active, and to prevent them from being active, they considered child abuse. And he said the way that they dealt with, and they didn't do much homework. They worked hard in school, work hard, play hard, work hard, play hard, and then little or no homework. And he said, basically, they have the best education system in the world by doing the exact opposite of what we do. So, international comparisons, learning from other countries, I would recommend that kind of study. So let's don't assume we know what they're doing, because I was dumbfounded when I read that. So anyway, we'll add. You find odd things in the newspaper. Remember those things? Open up like that? Okay. Okay, so maybe last thing on this one. I'm really promoting ecological models. The idea that you need to intervene on multiple levels. And as a psychologist, I was trained as a psychologist and worked for quite a while at intervening on individuals and trying to motivate and educate people to change their behavior. And it just doesn't work well enough in environments where it's dangerous or inconvenient or impossible to go out and be active. So we need to work on multiple levels. And so at one level, you could redesign a park and put in playgrounds and put in tennis courts and put in basketball courts and that sort of thing. But now we're getting evidence that if you have a well-designed park and you provide programming and events that draw people in and you promote the use of that park, well, that's even better. Well, that's consistent with an ecological model. So you need to work on the built environment, the social environment, and then help give people the skills. So, and another example, creating safer walking conditions around schools. That's the built environment, and organized walking school buses. That's the social environment, and enforce speed limits. All right, so that's kind of a combination there. So I think what we're learning, what I see, is the more levels we work on, the more successful we are. And in school programs, the part I skipped over is we're learning that no matter how good we make physical education, it's not going to be enough. We also need to have better recess. We need to have after-school programs. We need to have safer to school. We need to do classroom activity. Okay, we have some exercise scientists here, so I'm going to give you my suggestion for phase one. So that's epidemiology, establish links between health behavior and health. And I have to say, after working on this issue for 20 or 25 years, I'm quite disappointed that we don't have good dose-response data on physical activity and health outcomes in youth that will allow us to have real evidence-based guidelines. Because I don't think we do. That's just not been a focus of enough people's research. yeah, we know that there are a lot of health benefits, but I think the dose response is still lacking. So to me, that's been a need for decades. And do these vary by population subgroup? And so we need these for stronger basis for physical activity recommendations, not to mention sedentary behavior. So we need that for adults as well. So take this message back to your exercise science colleagues. I think somebody needs to have a really serious series of studies creating those data. And I'm happy to for somebody to tell me, okay, we've just done that in the past 5 years, but I'm doubting it. So I'm gonna throw you a curveball, and as somebody who complains all the time that NIH puts grossly too much emphasis and money in genetics, I'm gonna encourage some genetics research. Because I think the whole field of epigenetics really turns everything upside down. Because I've always been taught that genes drive everything, right? It's your genes that affect your look, and it's the genes that affect your risk of disease and all of that. It's the genes that affect your behavior. But now we know, well, gee, our environment affects the genes. It turns the genes off and on, either permanently or temporarily. And so I think as physical activity people, we need to get in this game. So we know the mechanisms, and we need to be building the evidence on how and why physical activity might affect genes. Because my guess is, and it's just a guess, that there's going to be a lot of effects on the genes from physical activity, given the number of systems in the body that physical activity affects, which is virtually all of them. So I think it's so fascinating now that it's really the environment and behavior and genes. I've heard it described as a kind of a dance. There's this interplay going on all the time. In the past, the way I looked at it, the geneticists were very interested in determining the genetic, amount of variance accounted for by genes, but they never measured behavior and environment. That was kind of implied, or error variance, or something else not of interest. So now that we know about this interplay, it's really necessary for them to put measures of behavior and environment in their studies, and they don't know how to do that. They need us to do that. So I think this is a way to move our field forward, to improve our measures of behavior and environment, to get involved in bigger studies, because genetic studies are often supported at very high levels of funding that we could be a part of. So I think we need to get in that game. And not everybody, but I think this can help our field by moving our science forward and getting us into the same rooms with the genetics people, which is where all the money is going, or a huge amount of it. So, maybe a little exaggerated and biased, but you tell me what you think. So I am just going to finish with making a couple of invitations. I encourage you to come to our Active Living Research Conference. You've already heard an advertisement for that, and it'll be in Clearwater, Florida, early next year. And it'll be great as usual, and it will be active. But if you need a conference before that, then I will say Sawadee, hello, come to Thailand for the International Physical Activity and Health Conference that is going to have strong themes about policy environment. It'll be a great conference. It's coming up in November. You've got plenty of time to book your trip. Sorry you missed the deadlines. Anybody planning to go to Bangkok? Okay, but that's it, except for I would like to end with two things, and one is in active living research we take credit for bringing active applause to the United States. So that means that you give me a standing ovation, whether you like it or like my talk or not. And then we're going to stay standing, and we're just going to do a little bit of activity, right, Janet? Here's an expert. You come up here with me. Come on. I need some help. And Steve, I need you too. And I like leaders to lead. And so, Michael, come on up. Morgan, come on. Our two Morgans. Let's start out these leaders. Okay. All right. So first, active applause. Thank you so much. I really appreciate it. We start walking. Okay, that's the basics of everything. We got to walk. And so what I'm going to do is I'm going to demonstrate for you one of my favorite activities from when I was a kid. And then I'm going to ask each of you to demonstrate one of the activities when you were a kid. So we get a variety of ideas here, okay? And so one of the things I like to do, I had a tree in my front yard that I could climb, so I'm going to climb that tree. All right, I'm climbing that tree, and some of those you got to reach way up there. You got to reach way up there. Okay, stretching out a little bit. Okay, see how high? Don't look down, you'll get scared. All right. So okay, so now we're climbing the tree. Let's see what Jana is doing. Jenna is kayaking. She's out there on the river or the lake? On the bay. Okay, she's in the salt water. What do you like about kayaking?
Going with the tide one direction and maybe stick.
So one, you get more of a workout than the other. Okay, now we're going to kayak to Michael and see what he's doing. Tag. You playing tag? Okay. Miss Morgan, tag, you're it. What are you going to do? Swimming. Don't swim into the person in front of you. That could be painful. Okay, we're swimming, we're moving. Okay, get those arms going. Okay, we're swimming over to where Steve is. Steve, what you going to do?
Stack field head.
Oh, one of my favorites. I love that. Okay. You got to lift with your legs. Do that, you know that? We didn't know Steve remembered his arming that well. This is really tiring, Steve. It's picking up the hay. Okay, Morgan, you're going to take us home.
Steve stole mine. Volleyball.
Volleyball. Okay, you need to. I want to see some spiking now. Spiking and serving. What else do you do in volleyball? Serve. Hit. Pass. Pass it off to the other. Okay. Okay, so how everybody feeling? Better? Okay. Thank you so much. I'm honored to be your first lecturer for this, and good luck for everything you're doing.